I love Alan as a warm-up. He says everything I want to say, and then, I can sort of do it quickly and let you all have questions. Thank you, Anna. It's a great pleasure to be here today. I owe you an apology about all those letters. My secretary sent that off to the conference advisors. I wouldn't normally put all those letters after my name, so please just ignore that. Now, I'm here really in the capacity as I'm billed as government advisor. I also work in the South East as a director of public health. And, increasingly, a lot of the stuff that we're seeing centrally now is stuff that, in a sense, the ground has been set for. For instance, we have been working with business in the South East for quite a while, and some very interesting relationships with chambers of commerce and with the charitable and voluntary organisations as well, to try and improve, our reach into people's lives. And I think that now has become really the mantra of what the coalition is saying, really. It's about individual people's lives as well as big government and big society and small society. So what I'm going to do is speak really from the Department of Health Central's perspective. And again, you'll forgive me here because this is in the middle of a process. We don't have a public health white paper. We haven't made announcements. That is in the realm of the political sphere, and I'm not going to make announcements here today, so you're going to be disappointed right away with this speech. But what I do want to do is share with you some of the thinking and what is going on. So let's do that, and to say that when the government came in May, and I've been in the Department of Health working with Sally Davis and with the civil service since that time, working with them and relating to the other 9 regional directors who cover all of England and provide senior leadership. So I'm there really, as the nodal point. What we heard immediately was that this isn't just wiping the slate clean and saying everything that happened before was rubbish. This is building on much good work. And I want to thank the people here because it is an expert audience and you have contributed to improved health in the population, and the trends have been generally very good. You'll know where they're not good. I don't need to rehearse that with you. So there have been some great examples of progress made, and we have inspirational people here this afternoon talking about tobacco and other elements of progress. And I think we have seen a drop in the prevalence. Not so good on people's eating and lifestyle, and that is much more complicated, as you know from the Foresight report. So the issue here is really about opening up new fronts on how to address this. Not so good either on the disparities between, people who are experiencing better health and better functionality, because that's really what it matters for me. When people are living so long, how are they functioning? And those who are much less functional for much longer periods of time. And we know these disparities. And the question is, have we run up against a blank wall on this? Do we need to open up new fronts? And I think a lot of what you'll hear in the white paper is about that thinking. On the other hand, vigilance against threats. We have had an experience of a pandemic, admittedly not, as catastrophic as some of previous ones, but what it did show was how very well the system can work together when really the chips are down. And that's always the case in my experience in my professional careers. When it's really the chips are down, people just shove away the barriers and just get on with it. The question is, how big are those barriers when they go back together again? And why is it so difficult to get certain things to happen? So we know this can be done in a crisis, but what we're looking at here is how can we sustain that kind of joined up working. So the white paper, what it is going to set out, this is very much the ethos of what you will see coming out in December. There is a renewed interest in prevention. And an acknowledgement that perhaps we haven't used all the levers within both the health service and beyond to prevent the kind of problems people get into. So you will see a lot about that and preventing ill health particularly. So quite a lot of that will be health focused, but also what can we do more on the upstream work. There is a new emphasis on responsibility. Now, this isn't that new because, over the past year, I have seen several very interesting and reflective documents about what is the role of the individual and the state. you know, what supports what. And now we have, of course, the whole concept of big society. An interesting thing, I'm sure you'll want to discuss that throughout the day, what that means. But what it most certainly means is that there'll be much more emphasis on local, right down to, you know, people's homes, parishes, communities. So what does that actually mean for the way public health operates? And who is public health in that kind of environment? And I think probably a welcome introduction of an emphasis on evidence. And any of you who are in there, and I know there are research folk here today and from the universities and so on, you'll know the frustration of the big evidence gaps we've got. And, you know, okay, we do an awful lot of interesting and very good stuff, and we do it and we learn and we share it, but actually does it work on a kind of industrial scale to solve some of the very big problems? And that we don't know. And there is really not enough evidence to give people the confidence to invest. And we're talking now about economics here. You know, we're in a hard economic situation. Where do we put those limited resources to invest in programs that actually work for those communities? So I know that what the ministers want, the Secretary of State wants, was not to get focused on single issues, but to work across the issues. And in that, and we'll talk a little bit in a minute about the kind of mechanisms that the Secretary of State is putting in place, it will be very much across government. That's great. We've been talking about that for a long time. It's happened in sort of varying degrees. But this is for real. This will be, you know, at the highest level, a drawing in and a holding to account, actually, for how we deliver on the health of people's health. Because every time you do surveys, it's so important. It's the one thing that keeps coming out that people care about. And, you know, working through the system. Well, let's just say what those words mean. So, this is the kind of way it's going. And some of you will be familiar with this, so I do apologise for that. Others, you know, may not be, so I'm just going to sort of move through it. Now, you say, well, okay, the Directors of Public, we have, approximately 150 local authorities, and where we have Directors of Public Health, there are about 20 vacancies, most of them are jointly appointed, 80% of them are jointly appointed. So what's new about this? The word moving is new. They really will be in local government and employed by local government, and that isn't the case at the moment. And that will be a huge socialisation change. It'll be really two very complementary perspectives coming together in one place. This one, outcomes, we've talked about outcomes forever, really. But these outcomes that we're looking at now will be outcomes to which people will be held account. So it's really quite important that the outcomes are meaningful to people's lives, but also that we can attribute stuff that's done to these so that we know whether we've done well or not. And that's quite a challenge. This is new, the idea of a ring fence, and it's causing a lot of discussion at the moment. But I think it's just important to say that what it demonstrates is the importance that is actually given to public health, because you'll know the old phrase, put your money where your mouth is. Well, you know, whatever is in this ring fence budget, and I have to tell you, I don't know how much it is, so I'm not going to try and guess that. But there will be one, there will be a discrete fund for health improvement. And it will be, within the remit of local government. And people will be held to account for outcomes. So this is new, and I think it's symbolically very important. What I like about this is the idea that this joins both government across, but it also joins the health dimensions across at the local level. How many times have we said the importance of the contribution of local government and the health system to health as a whole, and everything else that sails in it, actually, all the other relationships? Well, this is really an attempt to join this up and make it different. Then we have this concept of the public health service. What is that? What is its ethos, its values, its vision? I think you will see that coming through in what's coming in the next few months. And as we said, the evaluation. So I just have two further slides. There's quite a lot in them, though. So I'm going to just focus on a couple of words here, just to kind of identify what to look out for.